Good morning, everyone, and thank you for joining our weekly COVID-19 briefing. Today's briefing will run until 10:30 this morning. As always, we're being joined by Acting Health Commissioner Dr. Cheryl Bedegal. As a reminder, members of the public who would like to watch today's briefing are directed to view the live stream on the Health Department's YouTube channel. As always, we will present remarks first in English, then in Spanish, then open up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions and that we limit questions to 2 or fewer due to our limited time. If we have time for a second round of questions, we'll allow that. Please keep your questions focused on the topic of the COVID pandemic and the city's response to it today. With those instructions out of the way, Dr. Bedegal, would you like to start us off?
Sure. Thank you, Jim. So good morning, everyone, and thank you all for being here today. We don't have any big announcements today, but the news overall is still not great. We're still seeing COVID cases and hospitalizations rising in Philadelphia. I do hope that our recent mandates will help slow the spread of the virus and keep our friends and loved ones out of the hospital. So I wanted to take some time today to address a few questions that we've gotten over the last week. Firstly, I've heard from some people asking what they should do about healthcare providers who don't want to get vaccinated. For this question, I want to start with the most basic lesson taught to medical students and to other healthcare providers. First, do no harm. We know that transmission of COVID from healthcare workers has been a major problem at nursing homes, and that we've also seen cases in other healthcare settings. According to the latest data that we've received, there are more than a dozen long-term care facilities in Philadelphia that have fewer than 50% of their staff vaccinated. When we commit ourselves to become doctors, nurses, medical assistants, and other types of healers, we commit to doing everything in our power for the health of our patients. That sometimes means long hours, missed meals, time away from loved ones. It means getting our routine vaccines, flu shots every year so we don't pass the flu to our elderly patients or to our patients with asthma. Pertussis vaccines so that we don't pass whooping cough to newborn babies too young to fight it off. And it means getting our COVID vaccines, even if we really, really don't want to. Because we all know that it is simply unacceptable to take the risk of passing a potentially fatal infection to the patients who come to us for help. And if you're more committed to not getting the vaccine than to the safety of your patients, it's time to do something else. Healthcare is not for you. So next, we're hearing questions about where people can get tested for COVID. With cases rising here in Philadelphia, it's important that everyone who is feeling symptoms of COVID or who's been exposed to a confirmed case gets tested. As a reminder, the symptoms you want to keep an eye out for are fever or chills, a cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Our phila.gov/testing website is still active and allows you to search for the site that meets your needs. You can look by location. You can also see sites that offer pediatric testing, sites that will test you with or without symptoms, and those that offer drive-through or walk-up testing. We want to make sure that anyone who has symptoms of possible COVID-19 or who has been exposed to someone with COVID gets a test. People who know they have COVID are more careful in how they isolate so they can protect their family and friends. They're more likely to stay home from work and to tell their contacts to get tested. Many people have mild symptoms like a runny nose, sore throat, or headache. Symptoms that may be nothing, but that could be a sign that you have COVID and could pass it to those you love. If you do test positive, or if you've been exposed to COVID, please call our call center for help preventing the spread of the infection. That number is 215-685-5488. The trained staff there can walk you through the next steps for isolation or quarantine. That holds for children too. As we get closer to school starting, it's important to recognize that many children with COVID may present with just a single symptom. If your child is sick, please, please don't send him or her to school or to daycare. Get your child tested and follow instructions for isolation to prevent an outbreak that could close down a school. Again, phila.gov/testing has sites available all across the city. We've also heard lots of questions about booster shots. Who needs a third shot and when? For today, only people with immunosuppression who had the Pfizer or the Moderna vaccine need a third dose, which should be given at least 4 weeks after their second dose. Talk to your healthcare provider if you have questions about whether you need an additional dose. It is also very likely that the CDC will soon recommend booster doses for high-risk groups 8 months after they complete a 2-dose vaccine series. Our plan, should the CDC proceed with that recommendation, will be to utilize our existing network of vaccine providers to give those additional shots. We'll follow the CDC's lead in terms of the specific groups for whom boosters will be recommended. I just want to remind everyone that we don't want to get ahead of the science here. Let's continue to follow the recommendations from the CDC and give third doses when and if they're indicated, but not before. Thank you all. Now Zelly will present these comments in Spanish.
Buenos días. Lo siguiente es el informe de la doctora Vergo. No tenemos ningún anuncio hoy, pero las noticias en general todavía no son buenas. Todavía estamos viendo que los casos de COVID y las hospitalizaciones aumentan en Filadelfia. Esperamos que nuestros mandatos recientes ayuden a frenar la propagación del virus y mantengan a nuestros amigos y seres queridos fuera del hospital. Por lo tanto, quería tomarme un momento para abordar algunas preguntas que hemos recibido durante la última semana. En primer lugar, he escuchado a algunas personas preguntar qué deben hacer de los proveedores de atención médica que no quieren vacunarse. Para esta pregunta, quiero comenzar con la lección más básica que se enseña a los estudiantes de medicina y otros proveedores de atención médica. Primero, no hacer daño. Sabemos que la transmisión de COVID de los trabajadores de salud ha sido un problema importante en las residencias de ancianos y que también hemos visto casos en otros entornos de atención médica. Según los últimos datos que hemos recibido, hay más de una docena de centros de atención a largo plazo que tienen menos de 50% de su personal vacunados. Cuando nos comprometemos a convertirnos en médicos, enfermeras, asistentes médicos y otros tipos de curanderos, nos comprometemos a hacer lo que está a nuestro alcance por la salud de nuestros pacientes. Eso a veces significa largas horas, comidas perdidas o tiempo lejos de los seres queridos. Significa recibir vacunas de rutina, vacunas contra la influenza todos los años para que no transmitamos la influenza a nuestros pacientes de edad avanzada o a nuestros pacientes con asma, vacunas contra la tosferina para que no pasemos la tosferina a los bebés recién nacidos demasiado pequeños para combatirla. Y significa recibir nuestras vacunas contra el COVID, incluso si realmente no queremos. Porque todos sabemos que es sencillamente inaceptable correr el riesgo de transmitir una infección potencialmente mortal a los pacientes que acuden a nosotros en busca de ayuda. Y si usted está comprometido con no recibir la vacuna, que con la seguridad de sus pacientes, es hora de hacer algo diferente. La atención médica no es para usted. A continuación, estamos escuchando preguntas sobre dónde las personas pueden hacerse la prueba de COVID. Con el aumento de los casos aquí en Filadelfia, es importante que todas las personas que sienten síntomas de COVID o que han estado expuestas a un caso confirmado se hagan la prueba. Los síntomas que desea tener en cuenta son fiebre o escalofríos, tos, dificultad para respirar, fatiga, dolores musculares o corporales, jaqueca, pérdida del gusto o del olfato, dolor de garganta, congestión o secreción nasal, náuseas o vómitos o diarrea. Nuestro sitio de web phila.gov/testing sigue activo y le permitirá buscar el sitio que satisfaga sus necesidades. Puede buscar por ubicación y también puede ver sitios que ofrecen pruebas pediátricas, sitios que lo analizarán con o sin síntomas y aquellos que ofrecen pruebas de conducción o sin previo paso. Queremos asegurarnos que cualquier persona que tenga síntomas de posible COVID-19 o que haya estado expuesta a alguien que con COVID-19 se haga una prueba. Las personas que saben que tienen COVID son más cuidadosas en cómo se aíslan para proteger a sus familiares y amigos. Es más probable que vayan al trabajo, que no vayan al trabajo y que les digan a sus contactos que se hagan la prueba. Muchas personas tienen síntomas leves como secreción nasal, dolor de garganta o dolor de cabeza, síntomas que pueden no ser nada, pero podrían ser una señal de que podrías tener COVID y podrías transmitirlo a los que amas. Si usted da positivo o usted ha estado expuesto a COVID, por favor, llame a nuestro centro de llamadas para obtener más información para prevenir la propagación de la infección. Ese número es 215-685-5488. El personal capacitado ahí puede guiarlo a través de los próximos pasos para el aislamiento o la cuarentena. Eso también es válido para los niños. A medida que nos acercamos al inicio de la escuela, es importante reconocer que muchos niños con COVID pueden presentar un solo síntoma. Si su hijo está enfermo, por favor, no lo envíe a la escuela o guardería. Asegúrese que su niño se haga la prueba y siga las instrucciones de aislamiento para prevenir un brote que podría cerrar la escuela. Una vez más, www.philly.gov/testing tiene sitios disponibles en toda la ciudad. También hemos escuchado muchas preguntas sobre las inyecciones de refuerzo. ¿Quién necesita una tercera inyección y cuándo? Por hoy, solo las personas con inmunosupresión que recibieron la vacuna de Pfizer o Moderna necesitan una tercera dosis que debe administrarse al menos 4 semanas después de su segunda dosis. Hable con su proveedor de atención médica si tiene preguntas sobre si necesita una dosis adicional. También es muy posible que la CDC pronto recomiende dosis de refuerzo por sus grupos de alto riesgo 8 meses después de completarán una serie de vacunas de 2 dosis. Nuestro plan, en caso de que la CDC proceda con esta recomendación, será utilizar nuestra red existente de proveedores de vacunas para dar estas vacunas adicionales. Seguiremos el ejemplo de la CDC en términos de los grupos específicos para los que recomendarán esfuerzos. Solo quiero recordarles a todos que no queremos adelantarnos a la ciencia. Sigamos siguiendo las recomendaciones de la CDC y demos la tercera dosis cuando y si están indicadas, pero no antes. Muchas gracias.
Thank you very much. Thank you very much, Zelly. We'll now move to Q&A. Again, reporters are asked to limit their questions to 2 or fewer and ask that you stick with the topic at hand. If there are any reporters who do not get the opportunity to ask questions, please follow up with us by email and we'll get you an answer. First up, we're going to go to Laura McChrystal from the Inquirer. Go ahead, Laura.
Hi, Dr. Bedigol, have you seen an increase in people getting vaccines in the week since the mask mandate went into effect?
Yes, so we've seen an uptick. It's small so far, but a few thousand. We had been running around 15,000 a week. We were 18,000 for last week, so up a little bit. We're hoping that will go up more as the word gets further out.
Okay, and does the city have a sense of breakthrough infections, how many there are, and whether they are increasing? Because I've seen reports elsewhere that other areas are reporting an increase in breakthrough infections.
Yeah, we are looking at breakthrough infections. The breakthrough rate overall is about 1.3%, but it does appear that it's higher with Delta. We're trying to look also at hospitalizations because just having a breakthrough case, if it's a runny nose, sore throat alone, other than not wanting to transmit that, isn't necessarily that serious. So we're looking at hospitalizations. So far, it looks like hospitalizations in Philadelphia predominantly people who are unvaccinated. But we're continuing to look at that data. The hospitalization data lags a little bit, so it does take a little while to get those numbers in.
Okay, thanks. That's all.
Thank you very much, Laura. Next up, we're going to go to Claudia Lauer from the AP. Go ahead, Claudia.
Hey, how are you? I was wondering if you guys had a breakdown of, you'd mentioned, healthcare workers inside of long-term care facilities and some of them not being vaccinated. Do you have a breakdown of those facilities and how many people are vaccinated or percentages for any of those facilities?
We do get reports from the facilities of the residents who are vaccinated partially and fully, and the staff who are vaccinated partially and fully.
Is that something that we could get access to or that you would share?
I believe that data is shared with us confidentially. I would have to check on that. I do want to ensure that we continue to get that data because it's data we use for technical assistance, as you can imagine, to make sure we can work with those places to increase their rates. So we'd have to check on that.
Got it. Okay.
Claudia, if you want to drop us a line, I'll follow up with you and see if we can get something to you.
Thank you.
And then with that, we'll go to David Melandra from Philly Sports Network. Go ahead, David.
Hey, Dr. Bredick, I just want to follow up on something. I saw Las Vegas and New York and New Orleans are enforcing proof of vaccination for those people attending sporting events indoors and now outdoors. Are there any plans for Philadelphia to enforce something like that?
So nothing is off the table. We are, as I've said before, trying to go with the minimum necessary and to avoid having unnecessary economic impact if we can avoid it. We started with mandates in a little bit of a different place than some of these other cities, which started with entertainment venues. We started with the looking at where are people most vulnerable and where is the most spread occurring. And that's how we ended up deciding to go with the healthcare institutions and colleges and universities. We're hoping this does the trick. We should start to see something in the next few weeks if it's working, both in terms of increased vaccination rates and in terms of first leveling off and then decreasing cases. That will take a little while to see. If we have to, we can do more. We're hoping not to have to, but with this pandemic, you never say never.
Do you have any concerns right now, since with students returning back to colleges and with college football season starting up, people going back to packed stadiums?
I mean, I have concerns about everything, as you can probably imagine. Outdoor stadiums with people, in seated areas are a little bit less concerning than concerts where people are packing together. And I'm talking about mosh pits. But, for everybody, it's going to be a good idea to put a mask on, even if you're vaccinated, if you're packed into a crowd. Most of the area colleges and universities do have vaccine mandates. Our mandate just kind of generalizes that and makes it more uniform, makes it a little bit sooner for some. But I think everybody needs to be careful at this point in the pandemic, even people who are fully vaccinated. Really, if you're in a crowd, if you're in an indoor place, put a mask on.
And last one for me, have you had talks with the Philadelphia Eagles and the Phillies about any changes that you guys can be doing in the next couple of weeks since the Eagles are going to be having their regular season startup?
So for the Phillies and the Eagles, in the outdoor seating, they're not required to mask. In indoor areas, they are required to mask. And we aren't changing anything beyond the city's mask mandate right now. Again, we'll be watching numbers closely and we'll do whatever we need to do to keep people safe.
All right, thank you.
Thank you very much, David. We've got a little bit of time left. If anybody has a second round of questions on COVID, we'll give a second. All right, I see Laura McChrystal from the Inquirer. Go ahead, Laura.
Hi, Dr. Bedigal, could you just give us a sense of how you think the mask mandate is going so far? Do you think that people are complying and that businesses and institutions are enforcing it?
So overall, it's going fairly well in that many, many more people are wearing masks and wearing them correctly than were wearing them before in inside spaces, and actually even outside of a lot of masks. And I know that just from walking around Philadelphia, but also from our mask surveillance data. Mask use is just up substantially. That doesn't mean we're all the way there. And anytime you implement something like this, it does take a little bit of work and a little bit of time to get it fully realized. People were doing this really well in Philadelphia. We actually had the highest mask utilization of any of the cities. We will get there again. I was impressed by how quickly businesses got the signage up and how quickly people put their masks back on. But we clearly still have some work to do. And we were getting some people, letting us know that they've had an experience going into a business where people weren't wearing masks or the owner didn't know about the mandate. But we're working with our colleagues in the Commerce Department to help get the word out to businesses. We've been sharing lots of communications materials. We will get this done, and we'll do inspections where we need to if folks aren't complying.
Okay, and I had also heard anecdotally, both from residents and business owners, that there was some confusion over the exception. Like people were interpreting it as I can walk into any business and flash my vaccine card and remain unmasked. Is that something that you've picked up might be like a widespread confusion, or what's going on there?
I haven't heard that one, although it doesn't surprise me. People listen variably. They don't always follow instructions perfectly. We're going to have to keep communicating on this. And we've been, putting out, I think, some very clear communications, and people will also sometimes misunderstand things because they don't like them. But, as I said, I haven't heard that one, but I'm sure that is the case for some people in Philly, and we will correct that where we see it, and we'll keep putting the word out. Everybody needs to wear a mask, regardless of their vaccination status, if they're in a public indoor place that doesn't have a vaccine mandate. If everybody in the place is required to be vaccinated, and that's their policy, people can be unmasked there as long as that's okay with the business.
All right, Laura, anything else for us? We may have lost her. It looks like David Melandra has his hand up again. We will add David. Go ahead, give us another question, David.
I just want to make sure I'm understanding this right. If within the next 2 weeks is that Made in America Festival, are you saying there should be a guest attending are required to have a negative test and also show proof of vaccination, or just straight masking the whole time?
So for Made in America, they're required to either be vaccinated or to have a negative test within 48 hours. And everybody, regardless of vaccination status, has to mask. It would just not be possible to walk through our crowd and know who had shown their vaccination card and who had not. So masking for everybody.
Okay, and is that going to be going forward, like as I was mentioning with the Eagles or the Phillies going forward?
So we have made a difference at this point in time between seated and unseated events. So, a concert that just has everybody packed together right around the stage, the mosh pit kind of thing. There, people do need to be masked. If they're in seated areas, they may be standing up in their seat, but they're not packed in that same way that they might be at a concert. They don't have to mask there if it's outside. That may change depending on what happens with the pandemic. But for right now, seated events outside, people do not have to mask. But an event where they're not seated and they're all smashed together like that, they would need a mask on. And that's for events of more than 1,000.
Okay, all right, thank you very much.
Thank you very much, David. Looks like Claudia from Lauer from the AP has another question. Go ahead, Claudia.
Hey, I was just wondering overall what kind of reaction you've gotten from, universities and healthcare facilities about the mandatory vaccines.
We've gotten a few questions about just how to do it and how to document and track things, but overall, we really haven't gotten a huge amount of pushback, and maybe that's going to change as they work through it. But, I think for colleges and universities, a lot of them are going to do this anyway. And it's really difficult for healthcare providers to say that they shouldn't be vaccinated. I mean, we all know this. We're a risk to our patients if we have an infectious disease. So, I'm sure there will be pushback from some groups at some point, but we really haven't gotten a negative reaction. And we've certainly heard from some very happy people.
Any more questions, Claudia?
Keep getting muted. Sorry. No, that's it. Thank you.
All right. I don't see any more hands raised. So with that, I will conclude today's press briefing. We will announce next week's briefing via Twitter and media advisory when the day and time are set. Thank you all again so much for joining us, and have a safe week.